where a massive consumer advocacy group like you would be holding an event to grill healthcare executives, where healthcare executives would actually show up. It says something about our community and about these healthcare executives, all of whom I have the pleasure of working with and knowing. And I know they are here, like I am here, in good faith because we care about the same thing you care about, which is improving our healthcare system, bringing down costs, and making people healthier. That's what it's all about. So I'll now, with my, I think I have 40 minutes. In terms of what Celticare has done and is continuing to do to try to control costs, there are really three elements to cost: unit costs, utilization of healthcare services, and administrative costs. On unit costs, we are not Blue Cross. We're a smaller plan. We don't have a lot of leverage in terms of negotiating price with hospitals. So we have, through network strategy, tried to develop networks that have lower cost institutions in them. And we've also implemented systems like tertiary management programs to try to ensure that people who don't need to be in an expensive hospital to get certain procedure or service are getting the service in the right setting. In terms of utilization, administrative costs, we have another advantage of having a national parent company and being able to leverage economies of scale. A lot of the back office functions, claims payments and other stuff like that is handled there, and we're able to reduce our administrative costs. In terms of this question, the reason we matter in this market is because we're adding value for consumers, particularly low-income residents of Massachusetts, and for the state. And we intend to continue to do that. Tax status should not be the measure. At the end of the day, whether or not we succeed in this market or not, just like any of the other plans here, is going to be dependent on whether we add value, whether we are providing a product for our members that gives them access to good quality health insurance at lower costs. And we have done that in Massachusetts to date. As the former budget guy, I know that after Celticare came into this market, we saved lots of money versus the trend we were on at the Connector and the Commonwealth Care program, and lots of money through Celticare's being the plan to work with the state to provide coverage to legal immigrants, the only plan during a time when the legislature defunded that program. So we have been committed to this population and to the low-income population here in Massachusetts, and we're going to continue to do that going forward. Thank you.
Our next presenter is Ms. Deborah Enos. Ms. Enos is the President and Chief Executive Officer for the Neighborhood Health Plan, and we've asked her to answer this question. The CHIA report indicates that you've been able to hold premiums with no increase from 2009 to 2011, and that in the data for 2012, you were the only insurer to project an actual decline in total medical expenditures. Can you fill us in on what is behind those numbers? Thank you very much.
Well, thank you and good evening, everyone. Thank you so much to GBIO for arranging this event and for Temple Israel of hosting us. And I have to say, there's a lot of work forums I'm in, but very seldom is it that I get that uplifting feeling like I'm at church on Sunday. So amen to that. So, thank you very much. I know I only have a few minutes here to answer the questions, but first I would like to tell you just a little bit about